This edition of the Health Beat, we're going to talk about chronic ankle instability. Joining us now is Dr. Gabriella Urcanen from Commonwealth Health. Dr. Urcanen, thank you for being here.
Thank you.
So when it comes to chronic ankle instability, what do you mean by that?
Chronic ankle instability is a condition that causes recurrent ankle sprains. Patients usually complain of their ankle giving way, chronic pain on the outside, swelling, and this occurs when standing, walking, and especially aggravated when walking on uneven surfaces.
So if you're starting to feel these pains and you think it could be chronic ankle instability, what are some of the causes that could lead to those issues?
An acute ankle sprain, any event that would cause your ankle to roll, would cause a chronic ankle instability. It's estimated that 30% of patients with an ankle sprain can go on to develop chronic ankle instability.
So if a patient came in to see you after some of these issues, how would you know for sure that it is chronic ankle instability?
The patients will present with pain and swelling along the outside, pain when moving their ankle and walking. Also, the history is very important. When a patient states that they have chronic instability and chronic recurrent sprains, that gives the clinician an idea that something is happening. So we will evaluate, do a physical examination, and in many cases use x-rays and or MRIs to fully evaluate the ankle and soft tissue ligaments.
So once you make a diagnosis, a patient comes in and you find out, okay, they have chronic ankle instability, what do you do at that point? Are there treatment options, or do you have to go right to surgery?
No, surgery is not indicated. The most important therapy is physical therapy, starting early rehabilitation to strengthen the ligaments, also strengthening the muscles around the ankle is the most important. Bracing, ice, elevation, and also anti-inflammatory in some cases.
Now, if you try some of those treatment options and you're still not getting any results and the chronic ankle instability is still there, at what point does that patient need surgery?
When they continue to have chronic pain, the symptoms of instability, and bracing orthotics no longer help. The clinician will then start to address surgical reconstruction of the ligaments around the ankle.
Doctor, for our viewers who may have issues with chronic ankle instability and they want to come in and chat with you or get an examination, what are the best ways to get in touch with you and find out more?
They can call our office at 570-288-3535 or also contact or go on the website commonwealthhealth.net.
All right, some important information for those that may suffer from ankle problems, which could be chronic ankle instability. Dr. Gabriella Urcanen from Commonwealth Health, thank you so much for being here for this week's edition of the Health Beat.